Hello, everyone, and welcome to Petworking, a podcast focused on pet care and animal health. I'm here today with Dr. Heidi Lobprise, veterinary dental specialist at Cibolo Creek Veterinary Hospital. Heidi is kind enough to join us this morning and address a topic I think is blowing up on the retail side of things from what we've seen at Global Pet and Super Zoo the last few years, but is also critically important to maintaining the health of your pet, and that is dental care and making sure that you're getting your dogs and cats teeth taken care of. Heidi, thank you so much for joining us on Petworking today. It's good to have you.
Thank you for having me.
Great. Well, Heidi, I was talking to Dave Merrick, and he mentioned that he could connect us, and so I'm so happy we were able to make this connection and have you on. Can you give us a little bit of background of how you decided to focus on dentistry and dental health within your practice, and talk about the importance that you see in obviously, everybody knows dental health is connected to overall health, but would love to get your take on how this became a passion and specialty of yours, and your thoughts on what pet owners can do to ensure the dental health and the overall health of their pets.
Absolutely. So I've always said that the good Lord takes care of fools, and I've been well taken care of. It was serendipitous that I started working part-time for Dr. Robert Wiggs. He's now passed, but he was one of the icons of veterinary dentistry. And I didn't get much at all education. Of course, this was 40 years ago now. But even today, veterinary students don't get as well-rounded an education on dentistry in some of the places. They can only really teach it to a select few. The thing of it is, day one in practice, you're dealing with dental disease, because so many pets, dogs and cats, have some form of dental disease, especially periodontal disease. And the infection and chronic inflammation of anything in the mouth, like you said, affects every single body system.
Yeah. I mean, I remember, I'm somewhat new to pet parenting. We adopted our dog Peony January 2017, and she was a 2 to 3 year old rescue. Came from South Carolina. My parents would not let me have a dog growing up. I always wanted one, and then as I moved through my 20s and college, it wasn't the right time to get a dog, but about 6.5 years ago now, we adopted Peony, and it completely changed my life. But so I one of the reasons I feel somewhat qualified to be doing this podcast is not only have I consulted on the pet care and animal health side of things for 10, 15 years, but now that I'm a pet owner, I've experienced it with her, and fortunately or unfortunately, she has gone through a number of health challenges. She's very healthy now, but we've had our bumps in the road along the way. But I remember bringing her in for her first physical after we adopted her, and our vet said, and make sure you brush her teeth. And it didn't really, I was like, oh, that's interesting. Yeah, I suppose you should brush a dog's teeth. And I was like, well, how often should we do that? Maybe once a week? And she looked at me and she was like, if you do it every day, you're really going to save yourself a lot of challenges in the long run. And for the first couple of years, Peony was not a huge fan of toothbrushing, but we've gotten into a routine now. And for the last 4 years, the last thing I do every night is I brush her teeth. I get my Verbac toothpaste out. I have a little finger brush, and the last thing I do before I take her outside, before we go to bed, is I brush her teeth and give her evening supplements. We go out and then we go to bed. But I feel like I tell people that, people are like, you brush her teeth every night. And they really don't seem to think it's common. And I was looking up some statistics from the American Pet Products Association, and they said that 65% of owners provide some form of dental care for their dogs. 30% say they brush their dog's teeth at least once a week. But then there's a 35% out there that don't provide any form of dental care. And I'm guessing that's where you're talking about, from day one, you're dealing with periodontal disease and, bad breath and gingivitis and cavities and teeth that are only being held in by plaque. Talk to us a little bit about, when you say that affects every aspect of a dog's health, what are the risks that people are taking by not brushing regularly, and how often would you recommend a pet owner brush?
Okay. So just out of curiosity, how big is Teeny?
Peony is 70 pounds. She's a lab mix. She's lying right here on the floor behind
me.
Peony, like the flower.
Peony, like the flower.
Peony.
Yes. Okay.
She came with the name, and we didn't have the heart to change it on her.
As long as she smells like a flower, there she is. So the reason I was asking is periodontal disease is even more important in our smaller breeds. Dogs up to about 25 pounds at adulthood. Those puppies need to get started. The periodontal disease is so important for them because they don't have as much bone. So if they get the periodontal pockets or bone loss of 1 to 2 millimeters, especially around the smaller teeth, there's going to be tooth loss. And sometimes it's almost unavoidable. Luckily, Peony, she has some good bone structure there. So she's going to be at risk for periodontal disease. Not quite so much, but for those little dogs, especially, be prepared for a lifetime of dental care. Absolutely. Because that's what we see most in our practice of periodontal disease. And with bigger dogs, certainly the brushing and everything else too, but the appropriate chew is very important if you're giving some kind of dental chew. If you can't bend it or indent it with your thumbnail, it might be too hard. If they go and crunch on it, especially if it has a like a round or a stick-like quality that they can really just localize that force, broken teeth. We see that a lot if they chew on antlers, compressed plastic products, bones, cow hooves, things like that. So that's important. Brushing is important for all dogs, especially the smaller ones. When we see good care, and it would say it's a team sport, a combination of home care with the pet parent, regular exams at your veterinarian, and regular dental cleanings. Because you and I brush our teeth, 2 times a day, floss once a day, right? Tell your dentist that.
Right.
We still go in for our cleanings and our x-rays.
Every 6 months, yeah.
Because there can be hidden things, even with excellent home care, especially with these small ones, you can still get some hidden problems. And that's why in people, they call periodontal disease a silent disease, because you can even have lots of changes and not a lot of pain. Your pet may have quite a few changes. Sure, the odor, the dog breath can be something. Sometimes it's really bad when they come to see us. We're kind of going, ooh, how are they living in that house, much less kissing the dog? and we get in there and start taking x-rays and the hidden disease. So general anesthesia, to be able to take hidden disease, protect the lungs, get full work done is so important.
Yeah. No, I think that's a concern for a lot of people because people don't want to put their dog under. They don't want to have them undergo anesthesia. I mentioned Peony has had some health challenges in the time we've had her. And one of them was she was diagnosed with a melanoma about 3.5 years ago. And so we opted to have the surgery done to remove it. We have pet insurance, so that wasn't a huge concern. And because of that, I am a huge advocate and always have been. I actually started one of the first studies I did in consulting in pet care and animal health was on the pet insurance market way back in 2009. I think it's still an underutilized product today, but makes the decision to get the appropriate medical treatment for your dog or cat a lot easier. But as part of that, our vet recommended, they're like, because she's going to be under anesthesia, this would be a great time to do a dental. And because I was brushing her teeth every night, my vet said to me, he was like, it was really one of the easiest dental cleanings I've done, and since then, we go in and they examine, and they haven't recommended that we put her back under anesthesia, but for a cleaning. I mean, I think we'll probably have to do it, at some point, because it's been a few years, but, right. I think, talk to us a little bit about, should pet parents be concerned about, anesthesia and obviously that's the safest way to do a dental cleaning, right? We see out there people offer these anesthesia-free dental cleanings, and it's really dangerous for both the veterinarian or whoever is offering a anesthesia-free dental cleaning, as well as for your dog. Talk to us a little bit about that.
So even if they do sedation and gentle handling and everything like that, it's like just the tip of the iceberg, literally cosmetic. They can clean the crowns. They talk about going up underneath the gum. That poor patient. I mean, there is no way you can get the complete work done you need to do without anesthesia. I need to take x-rays once a year on my patients. If we have any extractions or work, we use local numbing blocks. The thing is, as we've progressed in veterinary medicine, the risks of anesthesia have greatly reduced. And that includes doing a good physical exam, getting blood work and urinalysis and things like this. And if we identify any underlying issues, then we can manage those issues and really adjust our anesthetic protocol to fit that patient. Now, as a specialist, I get a lot of the ones nobody else wants to anesthetize. Plus, I can work a little bit faster, so that decreases anesthetic time. But there's a lot of very capable clinics out there that are very comfortable, even with older dogs, even with dogs with kidney, heart problems. I do see a lot of those, and we manage them well. X-rays are absolutely critical. They're not almost a must. They are a must. They're a requirement, because so much of the disease is underneath the gum line, and we can't see it without x-rays. And even with those patients that might have underlying or even beginning heart disease or kidney disease, even things like chronic arthritis, the constant inflammation of that ongoing dental disease can impact the rest of the body. And I told you I'm interested in senior care, can even accelerate aging. There's something called inflammaging that I've gone into the rabbit hole on that research. It's quite interesting. The key of it is some of the best days are that 2-week visit after you've taken out 18 teeth from the Shih Tzu or something like that really nasty mouth, and they come back in, the owners are going, he's like a new puppy. He's eating. He hasn't played like this in years. Oh my gosh, those teeth, I didn't think they were affecting him, but they were making a big difference. Now, the better story, never getting to that point of horrible teeth to where you have the miracle dog, keeping them healthy from day one.
Right. No, absolutely. Yeah. And we have a big soft spot for senior dogs here on Petworking. Oh, yeah. I don't know if you saw our episode. One of my close childhood friends just is in the process now. He'll be flying home with her in a couple of days, but he was down in Colombia this winter on a kite surfing trip and found a senior stray dog on the beach. And so he's paid for her rehabilitation in a hospital down there in Colombia and in Barranquilla. And so he just got clearance from the CDC to be able to bring her back to the US, and he's flying home on Wednesday or Thursday next week, June 1st. Yeah. So we have an episode on that. And one of the first episodes we did, the very first episode actually was a new product called Leap Years. I'm not sure if you're familiar with it.
Not totally. Okay.
It's an NAD booster. So to kind of slow the aging process and restore proper cellular function and vitality in senior dogs. And soon after doing that, I started Peony on it, and that has definitely made a difference. We're getting more of those. She's 8.5 now, if they got her age right. We're getting more of those puppy-like behaviors. But, I think you hit the nail right on the head, especially, with senior dogs, dental care becomes even more important. Now you're a certified board veterinary specialist.
Right.
How many certified how many of there are you? And what is the difference between taking your pet to your general veterinarian and going to a veterinary board certified dental specialist?
Yeah, so the American Veterinary Dental College, and there's a website so you can find board certified dentists, veterinary dentists. There's not very many of us. That's the shame of it. 200 worldwide, and European has a group, things like that. So it's quite small.
Wow.
Probably a little more than that. We had a new class of like 27 come through last year, but not uncommon. I mean, they're not common.
No.
Larger metropolitan areas, things like that. And for most dental care, veterinary practitioners are the general practitioners. And I've did that for 20 years, along with my dentistry. We get to do everything, which is quite interesting, especially as it comes to senior care. So most veterinarians are very comfortable with the great majority of dental procedures. When I lecture to them, I always tell them, number one, sometimes if you have a lot of work, do it into 2 different procedures. It's okay for, having smaller anesthetic times. If you do have a complicated procedure, if that periodontal disease on the little old dog is now so bad that the jaw may break, and it is a possibility that the bone can be so bad they can jump off the bed. I had a dog with both sides broken when he jumped off the bed. His periodontal disease was so bad. Then if you have a specialist in your area, you can always ask the owner if they'd like a consultation or a referral and, take it from there. But for the most part, and not all the universities have dentists. So it's kind of interesting, the veterinary colleges, but
Sure.
most veterinarians can handle most cases quite well.
Okay. So it would only be, in the case of requiring a referral to you or a consultation from somebody like you or with your qualification, a really serious condition. Your standard.
Mm-hmm.
Great.
Yeah.
And Heidi, I don't know, the extent to which, but it's been my experience that some pet insurance plans do cover dental cleaning. So that could be, if people are worried, I think I've seen anywhere from 300 up to 700 on average for a dental cleaning. But if you have pet insurance, that can be covered under your under some pet insurance plans. Obviously, we can't go through everyone and check them off in the time we have here today. But, for people out there, that is something to look into, to make this, recommended annual x-rays, cleaning, exam, more affordable and something that you can do without incurring a more significant financial expense. And then you get all the benefits of pet insurance as well, in case anything else happens to your dog or cat.
Especially in those smaller ones that I was talking about. Before we even had pet insurance, I would tell owners, pet parents, put money aside. You're gonna be seeing your veterinarian for dental disease, or even me. So be aware that there will likely be issues. So finding that pet insurance that covers preventive cleaning and x-rays can be very important, because in theory, except for a few individuals that have interesting immune systems, periodontal disease is completely preventable. Okay? So good regular exams, good professional care, good home care like you're doing. In some smaller pets and even cats, if they won't tolerate a brush, I like going with some of the dental wipes where you come from behind them, not in front. That's very aggressive, assertive. You come from behind them and scratch their cheeks and their ears, and then use the wipes as you pull back on the lips. And that way you can get some of these smaller dogs and cats that are difficult to brush.
Oh, that's a good technique. Yeah.
Mm-hmm.
When I started trying to brush Peony's teeth, I was using a regular brush, and she did not like it at all. And it was finally where, as she became more comfortable with us in the first few years we had her, and she grew to trust me more and more, I found, the finger brush actually works better, because she's more, she would let me manipulate her gums and get in there with it. I'd be curious, Heidi, what are some of the other, home care products you would recommend? One of, I obviously they're not all encompassing, and I wouldn't stake my dog's dental health on this, but Peony has really loved the wolffish skins from the Honest Kitchen. They're kind of a dried fish skin chew. Would you say, and then, I know there's the more common products out there, the Greenies, the Whimsies, there's a new one that I saw at Global Pet this year. It's kind of like, almost looks like a tube of deodorant. you click and it's got like a sodium hexaphosphate compound. Yes, hexametaphosphate, and it's chicken flavored, and the dog can lick it off the deodorant kind of tube. It purportedly aids in home care. What are your thoughts on these products? And, are there any that you would really recommend?
So there's so many out there. It's really confusing. And in theory, there's the Veterinary Oral Health Council that has products, VOHC, that has products that have gone through testing and everything else. That doesn't mean if they don't have the stamp that they're not effective. They just maybe haven't had the testing. We look at brushing as the gold standard. All right. The easier things get possibly the less effective, maybe more for oral odor, things like that, the water additives. If you're looking at anything that's going for mechanical, like chewing, you have to make sure that they actually chew it for, 30 seconds to a minute. If they take that piece and just gulp it down whole, not a lot of effectiveness there.
Right.
You get the chemical, like the sodium hexametaphosphate, that slow, soft plaque from turning into tartar. And it's the plaque that we can brush off. The tartar we can't. So if we keep it softer, then we have more chances of mechanical removal. The Orvet chews have delmophenol in it that kind of help make the teeth a little slicker, so the plaque and bacteria can't stick to it as much. So we have a combination of mechanical and chemical. And a lot of it depends on the patient and the owner. There's some cats out there you would not want to try to brush their teeth, so you have to base it on that. And if really good home care can be provided, then the professional cleaning may not be as often. But if you have a lot of periodontal disease and can't do home care, but want to help preserve those teeth, then we might have to go more frequently than once a year, depending on the pet. And depending on how healthy we want to keep them. So there's a lot out there.
What do you feel? I know there are some, diets out there from like Rocaine and Hills and things like that, purport to offer dental health through a kibble. What are your thoughts on those?
So in those, if it's mainly mechanical, like the TD, if they're sitting there and crunching it and chewing it, that helps squeegee the teeth, so to speak. If they swallow it whole, not so much effect. With some of the Rocaine, with the sodium hexametaphosphate, then you get some of that effect with your chemical as well as crunching the kibble. Okay. So that's where we get those combinations sometimes of mechanical and or chemical effects. And I know when I say chemical, people go, "Ooh, chemicals." It's everything's with the major brands certainly has been tested. So you mentioned the CET toothpaste from Verbac. I'm kind of fond of their flat rawhide strips. Some people hate rawhide because, they're not sure where it's from. It caused my dog to have hives. These are pretty well quality control manufacturer. And the fact of it is they're flatter. So remember I mentioned the round, crunching on the stick kind of thing. It has that flatness. So we probably won't break teeth. I just make sure owners know if their pet is going to swallow off big chunks at a time. So again, you can't just give it to them. Hang out with them for a little bit.
Yeah, no, it's always good. I think, the advice I've always received is if you're giving a chew, make sure you're supervising until you're sure that this is something that they can handle and it's not going to present a choking hazard.
Absolutely.
So, no, that's great. That's great. And you mentioned the VOHC. What I have heard is that can, that's getting that seal of approval can be a, 18-month process. Testing can cost like $150,000.
Yeah.
So, you mentioned that if it's a great, mark of, shows that manufacturer is really invested in, proving that their product is effective. But it at the same time, not every, dental chew startup can afford to go out and spend $150K to get that certification.
Right.
So, and Heidi, one of the last things I wanted to talk to you about, we talked about the periodontal disease. There's also, reports that I've seen of, bacteria from dental problems traveling to other parts of the body. How often do you see that? And, and what is the risk of, other illnesses arising from poor dental care?
Correct. And actually, we're learning a lot about that. So you get bacteria every time you chew from what's in the mouth. So, you handle that or you don't handle it, depending on how your system is. I have heart murmurs, but even now I don't take antibiotics prior to my dental cleaning anymore. So we're getting back away from using antibiotics as much because there's always bacteria in the oral cavity. It's just when it goes bad, when the neighborhood goes bad, and you get the pathogens that you have the real issues. What we're learning now, especially on the human side, is it's that chronic inflammation that's part bacterial infection, but also part of the body trying to fight the bacteria. Initial inflammation is good if you have an acute injury or illness, but when it stays around and is persistent, then it's not so good. Chronic inflammation can cause a lot of issues. The chronic inflammation, such as periodontal disease and diabetes in people, they've shown the direct correlation. And going with the inflammation with osteoarthritis and everything else, it can impact every single body system: liver, heart, kidneys, lungs, you name it. So the combination of the bacteria, but certainly that inflammation, getting that under control, getting rid of the teeth that are causing that chronic inflammation, cleaning up. So even gingivitis is inflammation. Getting a healthy mouth to have the healthier pet is really critical.
I think that's a great message and probably a good place for us to wrap up today. Heidi, thank you so much for taking the time. This has been incredibly helpful. Hopefully we can loop back and, as we have other questions on dental health and hygiene, we'd love to have you back on the show. And thank you so much for joining us for another episode of Petworking.
Excellent.
This is Peter Kenseth.
And one last thing, if your viewers, your listeners ever have a question, ask your vet. They're the experts.
True.
Yeah.
True. That's great. No, it's an important thing. Don't. Dr. Google is good, but always better to check with the experts, right?
Yeah, absolutely.
All right, Heidi, thank you so much, and thank you to everyone for listening. This is Peter Kenseth, and this has been another episode of Petworking. Thanks so much for joining us.
Bye-bye.